this is amazing. And it really made me think about sunlight. So this is a story by a lady by the name of Amy Honmeyer. Her 15-year-old boy was diagnosed with lymphoblastic leukemia, went into the hospital, actually started chemotherapy for it.
Which is blood cancer.
It's a blood cancer, yeah. And so the treatment for blood cancer is chemotherapy, which he started. The side effect of chemotherapy is suppressing the immune system. And unfortunately, he didn't realize it, but he didn't realize it immediately, but he developed a fungus flesh-eating infection in his lung and went into the hospital in June of 2024. This was in Minnesota, tertiary care hospital. And he got worse and got worse and got worse to the point where the only way that they could control this infection was to actually remove his left lung, which they did. So this is a 15-year-old boy. He is without his left lung. He only has a right lung. And he starts to decline even after that. They do a CT scan, and it shows that now the infection has moved to his remaining right lung. They have a family conference. And as Amy is telling me this story, I could hear her choking up. She's telling me this on the phone. She's saying that he's 15, he's completely awake, he's completely alert, he knows everything that's going on around him. He's on a ventilator, like a machine that they use for sleep apnea. It's like a BiPAP machine that's breathing for him. It's not intubation, but it's on his mouth. And the doctors, have done everything they possibly can, and they say, look, he's getting worse. Obviously, we can't take the right lung out. We can't put him on a heart-lung machine because there's no sort of destination to where he's going. We recommend not intubating him and making him what they call DNR, do not resuscitate. So they're like, wow, they were not expecting this coming. So they have a big conference. They call in help to, like, how do you explain to a 15-year-old boy that you're dying? And how is that going to feel? So they ask the doctors, how much time does he have? They say 2 days. So in this situation, they ask this boy, okay, you're going to die. What do you want to do with your life in the next 2 days? What do you want to do? And surprisingly, he says, I want to go outside. I just want to go outside. This guy grew up probably on a farm or something, and he spent his time outside. So he wants to go outside. So you know how, I don't know if you know this, but like if you're a nurse or you're a doctor and you've done everything you can and you're just completely horrified at the fact that this 15-year-old is going to die, and he has one request, you're going to move heaven and earth to fulfill that one request. And that's exactly what they do. They get this boy, the hospital bed outside. He's on a BiPAP machine the respiratory therapists have put together. So this guy is outside. And they're not putting him outside to get better. This is his dying wish. They also use this thing called a Firefly. It's like a light device that they were using. I'll be honest, I don't know which did it.
The Firefly, what's that?
It's a light device that gives off light at different wavelengths. And they would use that for about 3 times a day for 5 minutes. This guy does not die. After the first day, his white count starts to come down. That's like a measure of the infection that's going on in the lung. And by the way, they do a CT scan of his lung before this all starts, and it's just the remaining lung on the right is just filled with infection. It's horrible. By the second day, the white count comes down even more. And by the way, they haven't changed any of the other treatment. By this point, he's been in for 6 weeks. He has not seen the light of day, and he's still getting the powerful antifungal medication, amphotericin B and posaconazole. All of these things are really high-powered drugs that just completely fight fungus, but it's not working. He's getting worse. But now he's out for the second day. The white count's coming down, which is good. That's a good sign. His oxygen requirement is coming down. That's a good sign. He's requiring less and less oxygen. By the time he gets to day 5, okay, we're already past 2 days. He's off the BiPAP. He's on regular, just nasal cannula oxygen that you see people wearing on their nose. The doctors are scratching their head. They're like, we should get a CT scan to see what's going on. So Amy tells me that they get a CT scan of this guy, and they're in the room, And some even like swear under their breath, like they're completely amazed. Because on the CT scan, obviously the left lung is still gone, but the right lung, the disease is probably 60, 70% gone. And he's still alive. He goes home. There's no sign of the disease after treatment. And she just communicated with me to tell me that he just got his Make-A-Wish thing for his cancer. He's continuing treatment, and she just can't believe that he was literally 2 days away from dying. They changed nothing. They changed none of his treatments. The only thing that they did was they took him outside, and they were using this Firefly before inside, but they were using it more consistently when he got outside.
Maybe hospitals should be outside.